Greetings to all the participants of the 63rd International Conference on Medical, Biological and Pharmaceutical Sciences. I am grateful to the organizers of this conference for giving me this opportunity to present my research study with all of you. My name is Dhiraj Solanki and I am a researcher associated with Singhania University, Rajasthan, India. And my research topic is assessing the impact of Human Resource Department's Nurturing Connect program on compassion and empathy in physicians and surgeons and its influence on patient advocacy. Over the next 15 to 20 minutes, I am going to take you through my research study over the following headings: introduction, relevance of the study, objectives, materials and methods, results, and conclusion. We would now go to the introduction. I would want to take your memory a few years back when the entire human society was shattered with the experience of COVID-19 pandemic. It was like the entire world has come to a standstill, and even the medical fraternity, the doctors, nurses, paramedical staff, they were also in tremendous stress. Doctors, surgeons, physicians, they had no medicines, no clinical interventions for effective treatment. During such a crisis, the only thing that physicians and surgeons could offer to their patients were compassion and empathy. So compassion and empathy proved to be crucial. However, its impact needed to be scientifically studied, and for this reason, it has been taken over for study by me. This research can create more awareness in the medical fraternity about the effect of compassion and empathy in earning advocacy by patients, which is an aspirational milestone of professional success in medical profession. It can also encourage HR interventions on compassion and empathy, as both compassion and empathy can be developed through structured developmental interventions. Relevance of the study. After going through the various literatures, doing the literature review, we can make out that there are many previous researches which have been conducted on the aspects like compassionate care, compassion fatigue, dimensions of empathy, doctor-patient relationship, mindfulness, and emotional quotient aspects of doctors. But correlation of compassion and empathy with patient advocacy through influence of HR nurturing had a good scope for study. There was also a pilot study conducted to establish the relevance of the study. A single center observational questionnaire-based cross-sectional pilot study was conducted for 30 OPD patients at Bhaktivedanta Hospital, Mumbai, wherein 23 out of 30 patients expressed lack of compassion and empathy while interacting with the doctors. The objectives of the study: 1. To develop a tool to measure the combined attributes of compassion and empathy in physicians and surgeons. 2. To create developmental interventions called HR Nurturing Connect program for physicians and surgeons. 3. To develop patient advocacy feedback tool to measure patient advocacy score for physicians and surgeons. Fourth, to study the effect of HR Nurturing Connect program on compassion and empathy scores of physicians and surgeons in prescribed phases. And fifth, to study the impact of compassion and empathy on advocacy by patients. We next go to the materials and methods. This study was a two-arm, prospective, randomized, single-center study conducted from March 2023 to June 2024 at Bhaktivedanta Hospital and Research Institute, which is in Thane, India. A total of 30 doctors aged between 25 to 60 years were randomized by computerized generated randomization technique post their informed consent, and 15 each were allocated in the experiment group and the control group. There was a validated tool which was created for measuring compassion and empathy, which was called the Bhaktivedanta Index of Compassion and Empathy in Physicians and Surgeons, with an acronym of BICEPS. Similarly, a validated tool was created for measuring patient advocacy score with an acronym of PAS. Thus, the experiment group received the HR Nurturing Connect, whereas the control group received no such intervention. The BICEPS and the PAS assessments were conducted in both groups at baseline as well as 3 months, 6 months, 9 months and 12 months after the intervention in order to see the effect. So this study was conducted through an experimental method. The study had two parts. The part one essentially studied the effect of HR Nurturing Connect program on compassion and empathy, whereas the second part, it studied the correlation of patient advocacy with compassion and empathy. So we'll look at each part one by one. Let's come to the first part. The first part studied the effect of HR Nurturing Connect program on compassion and empathy in physicians and surgeons, and hence the null hypothesis for the study was HR Nurturing Connects have no effect on compassion and empathy in physicians and surgeons. The alternate hypothesis was HR Nurturing Connects have positive effect on compassion and empathy in physicians and surgeons. For sampling, a convenience sampling method was chosen. Sample size was derived statistically of 30 doctors. BICEPS scores pre-intervention of HR Nurturing Connect program and BICEPS scores post-intervention in the intervals of 3 months, 6 months, 9 months and 12 months post-intervention were collected. The data collected was analyzed through Mann-Whitney test, and thereafter the null hypothesis was rejected as the Z value of Mann-Whitney test suggested significant difference in compassion and empathy pre and post HR Nurturing Connect program intervention. Thus, the alternate hypothesis was found to be true, which meant that HR Nurturing Connects have positive effect on compassion and empathy in physicians and surgeons. Now let's come to the part 2 of the study. The part 2 of the study had null hypothesis as compassion and empathy in physicians and surgeons have no effect on patient advocacy, whereas the alternate hypothesis was compassion and empathy in physicians and surgeons have positive effect on patient advocacy. Again, the sampling method chosen was convenience sampling. The sample size was derived statistically, wherein around 210 patients were totally included in the sample size, which means 7 patients per doctor. Since there was a sample of 30 doctors, 30 into 7 is 210 patients. The data was collected on patient advocacy, PAS scores, pre-intervention of HR Nurturing Connects, and then 3 months, 6 months, 9 months, and 12 months post HR Nurturing Connect intervention. Now, this data was analyzed through Spearman's correlation test. And here too, the null hypothesis was rejected, as the Spearman's correlation coefficient value between biceps and PAS scores of both groups were high at all the intervals. And hence, the alternate hypothesis was found to be true, which meant that compassion and empathy in physicians and surgeons have positive effect on patient advocacy. Let's now go to the results. So in the results, we can see that compassion and empathy in the experiment group increased significantly, with the biceps scores of 65.47 at baseline, which increased to 83.79 plus minus a standard deviation of 7.19 at 12 months post-intervention. In comparison, the cumulative rise in biceps scores in the control group was minimal, with an increase from 65.48 at baseline to 67.69 at the time point of 12 months since randomization. The minor increase in control group could be attributed to participant bias. The next part of results mentions that the patient advocacy towards doctors in the experiment group increased significantly, with the PAS score of 64.48 at baseline, which increased to 90.12 plus minus a standard deviation of 10.13 at 12 months, accompanied by a positive percentage change from 21.39% at 3 months to 39.76% at 12 months post randomization. This indicates a significant improvement in patient advocacy for doctors who participated in the HR Nurturing Connect intervention. Conversely, the control group exhibited minimal increase in PAS scores, increasing from 63.53 at baseline to 65.89 plus minus a standard deviation of 3.34 at 12 months. The percentage increase was also slight, starting from 0.87% at 3 months and reaching up to 3.72% at 12 months post randomization. These findings suggest that patient advocacy towards doctors who did not participate in the HR Nurturing Connect program remain largely unchanged. Now, the third part of the result states that there was a high level of correlation between the biceps and the PAS scores, which means between the compassion and empathy scores and the patient advocacy scores in both groups at all time intervals. It suggested a strong positive correlation between biceps and PAS scores of both groups and high values of Spearman's correlation coefficient for both groups at the stipulated interval of time. So we now come to the conclusion wherein we see that both compassion and empathy can be developed through structured developmental interventions. In this study, the HR Nurturing Connect program was implemented, resulting in significant improvements in doctors' empathy and compassion, which in turn enhanced their treatment approaches and led to increased patient advocacy. The study evidenced effectiveness of targeted developmental interventions in fostering empathy and compassion among healthcare providers, resulting in better patient outcomes, overall healthcare quality, which also translate in patient advocacy. So this was all about the study. I would like to sincerely acknowledge and express my deepest gratitude to the dignitaries mentioned below for their staunch support and belief in the presented research. To start with, Dr. Ajay Sankhe, the Honorable Director of Bhaktivedanta Hospital, Mumbai, India, followed with Dr. Dhaval Dalal, the Head of Department of General Medicine and Integrated Medicine at Bhaktivedanta Hospital, Dr. Vijay Kumar Gavli, the Head of Research, Education and Center of Excellence at Bhaktivedanta Hospital. Would like to thank the management for their support, which includes Mr. Praveen Mule, the Additional Director, Non-Clinical Services at Bhaktivedanta Hospital, Dr. Shiv Prasad, the Deputy Director, Clinical Services at Bhaktivedanta Hospital. I would also want to acknowledge and thank some dignitaries, doctors, from whom I learned a lot by observing their patient interactions. To start with, Dr. Sanjay Parab, who's the Medical Superintendent of Emergency Services at Bhaktivedanta Hospital, Dr. Sandeep Patil, the Head of Department of Cardiology Department at Bhaktivedanta Hospital, Dr. Vishnu Agarwal, who's the Head of Department of Oncology Department at Bhaktivedanta Hospital, and Dr. Vikash Kumar, who's the Head of Department of Urology Department at Bhaktivedanta Hospital. So I thank all of you for being attentive to this presentation. Thank you very much.